Good afternoon. Welcome again to another installment of our Facebook Live program with the Pharmacy Department, sponsored by the Ellenville Hospital Rural Health Network program. My name is Mike Stearns. I'm the Director of Pharmacy at Ellenville Regional Hospital, and we provide services to people free of charge. Actually, if you give us a call, we'd be happy to go over your medication list with you, make sure you understand what they're for, how they're best taken, and answer any questions that you have. The number here at the hospital is area code 845-647-6400, and the pharmacy extension is 229. If we're not in the pharmacy at the time that you call, there is an answering machine, and we will get back to you as quickly as we're able to. I'm happy to be here with three pharmacy students today in varying parts of their programs of pharmacy, which is a 6-year course of study. I have Darshil Shah from Long Island University, Arnold and Marie Schwartz College of Pharmacy, Victoria Fenton from Albany College of Pharmacy, my alma mater, and a local young woman from Ellenville, Walworthing, Natalie Lugo, who is at St. John's Fisher College, Wegmans College of Pharmacy out in the snow belt. Right? So you're going back up there soon and it'll be snowing?
Oh, absolutely.
Okay. So this is the second part of a series that we wanted to talk about diabetes education. And today we're going to focus mostly on injectable medications for diabetes. Now there's at least 4 types of diabetes. The ones that are most familiar to people are probably type 1 and type 2. Type 1 is also the juvenile onset, usually, diabetes, which is an autoimmune disorder where your body eliminates your cells in your pancreas that produce insulin, and you need to have insulin from outside your body in order to thrive and grow and live. And type 2 diabetes, oftentimes injectable insulins and other types of injections are used to manage the diabetes. It is a progressive disease. We can slow it down some, but in the long run, most people do progress to one or more types of injections to help manage the diabetes. Now, what we try to do with diabetes treatment is to mimic what the body does, and the body produces a small amount of insulin called basal insulin that's released consistently throughout the day to support many different functions in the body. And then most people are probably familiar with that when you eat, your blood sugar goes up, and so what we try to do with a different type of insulin is to mimic what the body does by starting to release insulin shortly before you eat to a little bit after you eat to manage that sugar that's coming into your bloodstream and how the body handles and manages that. Because our body's always either building up storage forms of glucose or breaking down storage forms of glucose to support healthy function throughout the body, and certainly to get enough glucose to the brain to do all its metabolic functions in support of the rest of the body. So what I wanted to do today was I was going to start off and talk a little bit about the rapid-acting insulins. So these are the ones that are taken around mealtime usually, and most of them are taken anywhere from 10 to 30 minutes before up to 20 minutes after a meal. And these are the ones that we would want to take to manage the carbohydrate intake that we're taking into our body, again, at mealtime. So the ones that are most commonly available is insulin lispro, which we know is Humalog, insulin aspart, which we know is Novolog, and glycine is a little bit less common, but that's called Apidra. And these, their duration of action is usually about 3 to 5 hours, so they go into your body and they peak hopefully around the same time as the glucose peaks, and then brings you back down to a normal level. For those people that are testing their sugar, what we look for is your blood sugar returning to normal range by about 2 hours after you eat. So those are the 3 most common of the rapid acting. You'll see in many hospitals, sliding scales. People get sliding scales depending on what their glucose levels are. If they test their blood sugar before they eat, sometimes we think that's that's a little too late. We should have a little better idea of what the blood glucose level is, and if it's consistently high prior to a meal, then adjustments have to be made with other types of insulins, your basal insulin or some other insulins that we'll talk about, or some adjuncts, as Natalie will talk about in a little bit. I'm going to skip the short acting for a moment, and I'm going to jump into intermediate acting. Now, intermediate acting insulins are your NPH insulins or your lente insulins. These are not used as much as they used to be used in the past because we have other alternatives available. But the NPH or the lente, they usually peak in about 1 to 2 hours and last anywhere from 10 to 24 hours. And they're used more for an intermediate range coverage when needed. So we still do see them used occasionally, but not as frequently as they used to be used. And one thing that I want to mention here before I turn this over to my students is that most insulins are only stable for a certain amount of time out of the refrigerator. So if you're using an insulin pen or a bottle of insulin and it's out of the refrigerator, please check on the pen or on the bottle to see how long that is stable at room temperature, because the majority of the pens are probably stable for about 28 days. Bottles maybe 30 days, some go up to 42 days. But after that, the potency is not guaranteed by the manufacturer, so your results can start to become a little more erratic if you're injecting what you think is a certain amount of insulin and it may not be. So always kind of have an idea of when that pen came out of the refrigerator, when the bottle came out of the refrigerator. Also, don't leave your insulin pens and insulin in your cars during the summertime or in the wintertime, because freezing the insulin or cooking the insulin is probably not a very good idea. So be careful about that. Be aware of storage requirements for your insulin, how long your insulin will last once it's outside of the refrigerator. And at this point, I think that I would like to turn it over to Darshil Shah, and he's going to talk a little bit about the short-acting insulin. So, Darshil.
Hi, thank you, Mike. Hi, I'm Darshil Shah. I'm a P4 student at Long Island University, Brooklyn, and I go to College of Pharmacy at Arnold and Mary Schwartz College of Pharmacy. And I'll talk a little bit about short-acting insulins. The examples of short-acting insulins are Humulin N and Novolin R. So Humulin R is a short-acting insulin. It covers your insulin needs during the meals. It is taken usually 30 to 60 minutes before the meal, and it gives its peak effect around 2 to 4 hours, and its effects last for 5 to 8 hours in a day. Now, advantage of the short-acting insulin is that you don't have to take at each meal. Basically, the effect of short-acting insulin lasts a little longer, because therefore you take insulin at breakfast or supper and still have a good blood sugar level. Humulin R is a short-acting insulin. It controls diabetes in patients, specifically with blood sugar greater than 200 milligrams per deciliter. It can cover insulin needs for meals eaten within 30 minutes. And Humulin R comes in two concentrated forms, 100 units and 500 units per ml. Doses of insulin are measured in units. Within Humulin R U100, it is important to use a syringe that is marked for unit 100 insulin. And do not use Humulin R if it appears cloudy, thickened, or slightly colored, or if its solid particles are visible. And most important thing to note is it should not be injected into the muscle. It should be injected under the skin. I'll hand it over to Victoria.
So, I just wanted to say, just interject one thing here, and I'm going to ask my students a tough question. What's the #1 side effect of insulin?
I was going to talk about
Oh,
that.
okay. Well, then we'll
Hypo-
segue to Victoria to talk about the long-acting.
Hypoglycemia is one of the side effects of insulin.
Yes. So hi everyone, my name is Victoria and I'm a pharmacy student at Albany College of Pharmacy. So I'm going to be talking about long-acting insulin, which is also known as basal insulin. So there are a couple of different types. There's insulin glargine, which is brand name Lantus or Basaglar. There's concentrated insulin glargine, which is known as Toujeo. There's insulin detamir, which is brand name Levemir. And then there's insulin degludec, which is brand name Tresiba. So these long-acting insulins are important because you can use it usually once daily, maybe twice daily, but it's going to give you a steady supply throughout the day. So unlike the short-acting and the rapid insulins where you get peaks when you take your meals, this is going to give you just a steady, constant supply throughout the day, which is really important. So like I said, it's usually once daily dosing. The Levemir, sometimes they have you do twice daily dosing. And it's also different because it's not going to work right away when you inject it. It's going to take maybe about 3 to 6 hours for you to really have an effect. But then that's going to last about 24 hours, maybe a little bit longer for some, a little bit shorter for some, but it'll last you pretty much the whole day, which is really great. So then, like Mike said, the side effects I did want to talk about. With all insulins, your main side effects are you might get a little bit of weight gain, and you might have hypoglycemia, which is low blood sugar. And we talked about this a little bit last week with the sulfonylurea drugs. So low blood sugar, you just want to be aware of some symptoms of that. You might feel a little bit dizzy, confused, sweating, your heart might feel like it's racing, you might feel anxious. And if you have those symptoms, your blood sugar might be a little bit low. And if that's the case, you could just have something with sugar in it and it should raise it back up and be fine. But we also want to remember that if you're taking a beta blocker medication, so metoprolol or propranolol, that medication might hide the side effect of hypoglycemia. So your blood sugar might drop, but you might not feel those common effects. In that case, you might only feel sweating. So just go over with your pharmacist or your doctor different medications you're on and make sure that you're aware of if you might be on one that might hide that low blood sugar symptom. And then storage is important, like Mike said. So when you get the insulin from the pharmacy, you want to just go ahead, go straight home, put it in your fridge, and then when you're ready to use your pen, take it out, let it warm up to room temperature, and then you can leave it at room temperature. The Lantus and the Basaglar, you can leave at room temperature for 28 days. The Levemir, 42 days, and the Toujeo and the Tresiba, you can leave at room temperature for 56 days. But you just want to be careful at the end of that. You don't want to use it anymore, even if you have some left. Just get rid of it because you don't want it to be unstable or unpredictable. And then for administration, Darshil talked a little bit about that already. You're going to do it under the skin for all of these insulins. But then there's 2 important tips. The first one is, like we said, keep it at room temperature, and then also rotate your sites. And if you do those 2 things, you can prevent a side effect called, big fancy name, lipohypertrophy, which just means that if you're doing the same spot all the time and you keep it cold, you might get these little lumps of fat in your skin. So just avoid that, do room temperature, and just rotate your sites. And then your dosing, you might wonder, how does your doctor calculate your dosing for your insulin? And for these long-acting insulins, they're mainly going to look at your A1C and your body weight. They're going to give you some kind of initial dose, and then they're going to look at your blood sugar and either move it up a little bit or down based on that. So that's all I have for you about long-acting insulin.
Okay, one question though. We know what A1C is, but what is A1C for people that are watching?
Yeah, so when you go to your doctor and you talk about diabetes, the main numbers that they're going to be monitoring is your blood glucose, and that's just how much sugar is in your blood at that particular moment. And then A1C is basically a way to measure over the past 3 months how much sugar has been in your blood. So it's a little bit, your blood sugar, you might take it at different points in the day, and it might vary based on what you ate, But your A1C, that's a number that we can say, okay, average over the last month, how have you been doing? And typically above 6.5 would mean that you would have diabetes, so we want to try to keep it between 6.5, 7, depends on the person. But if you're getting up into 8, 9 or higher, then we want to make sure that we can bring that down. So just based on that number, we have a predictable answer to how your diabetes is doing and how we want to dose your medications.
Great, thank you very much. So one of the things, before I get to Natalie, one of the things that I also wanted to remind people is that Ellenville Hospital provides a pharmacy consult service where we meet with you and talk to you about all your medications, both the prescribed medications and over-the-counter medications, and anything else that you may be taking that we could help you with, and to discuss what they're for, how they're best taken, the best times to take all these medications, if there's any duplications of medications. And we also encourage you not just to call the hospital pharmacy, but also to talk to your pharmacist that fills your prescriptions in whatever location you get them filled. But I can give you the number for here again. It's area code 845-647-6400. The pharmacy extension is 229. Again, if we're not there to take the call, we do have an answering machine, and we'll get back to you as quickly as we can. So one of the things that I wanted to talk about is with these injectable medications, it's very important to know how to administer them. Not everybody does injections well when they first start, and instruction needs to be given. That can be done at the pharmacy, at the doctor's office, a diabetes educator, but it's really important that you understand how to do your insulin. Some of the insulins, or some of the adjuncts like Natalie's going to be talking about, require not only injecting them but mixing them before they're injected. Some come in a dry powder with a solution, also in the same syringe, and they have to be twisted and then hit. I think the manufacturer recommends 85 times for Bydureon, hitting it to put the powder in suspension. But there are nuances involved with how these are prepared and how these are administered, and the best way to do them, whether it's laying down, sitting, as Victoria mentioned, also rotating sites and things like that are very important as well. So always know how to administer the medications that you receive, especially injections. And with that, I'd like to turn it over to Natalie.
Hi everyone, my name is Natalie. As Mr. Stearns mentioned earlier, I did go to Ellenville. I currently go to pharmacy school in Rochester, New York, which does happen to be the snow belt. So now I don't wear gloves when I clean my car because I've been accustomed to the cold. But just saying what they were mentioning, that it is important to speak to your pharmacist, especially if you have any questions on how to administer either your insulin or even if it's an inhaler. Most pharmacies now come with demonstrations, so they have different inhalers. They have also insulin pens where they can show you exactly how you're supposed to turn it, how you're supposed to inject it, where exactly you are supposed to inject. So just making sure that if you do have questions, not being shy about it, your pharmacist is there to help you, and they are very knowledgeable on how you're supposed to inject. Sometimes it's better to speak to your pharmacist and not go to Dr. Google and try to figure out by yourself how you're supposed to do things. Like, we are there to help, and most pharmacists hopefully are very friendly. In our case, they are. But just making sure that if you do have any questions, making sure that you do go and ask. It's better to have the answer that you looking for. It's better to get your question answered than have any questions when you do come home and then something does bad happen. So always speaking to your pharmacist. As mentioned, I am going to speak about GLP-1 agonists. So as I mentioned with insulin, the insulin products that are available now, they do try to mimic your body. So GLP-1s are similar in that way, that they are trying to promote something that your body already makes, which is GLP, and that hormone is used to increase the insulin that's being secreted from your body, which therefore helps lower your blood sugar and, as Victoria mentioned earlier, lowering your A1C, She also mentioned A1C goals, so those are very individual now and patient specific. So just making sure that you go through with your doctor what your goals are with diabetes, since we did mention that it can be progressive, and our goal is always for you to be well controlled. Just some medications that are considered under the GLP-1 class are the most common ones that most people see are Victoza and Trulicity, but there is Byetta, Bydureon, and Ozempic. And most recently, they actually came out with an oral GLP-1, so a medication that comes in tablet form that you can take by mouth, which is Rybelsus. So that's another option if you're not comfortable injecting yet, that you could use Rybelsus as well. We mentioned about rotating your sites, so GLP-1s, that's also very important. Just to give you guys a reminder of what sites you can inject, it can be your stomach, your thigh, or your upper arm. So just making sure that you are rotating your sites. Some common side effects that you can see with these medications are things like nausea, vomiting, and sometimes a little bit of a rash from where you're injecting, and that's also another reason why we encourage you to just switch sites between injection. Importantly, we also spoke about storage, so making sure you're storing it in the fridge, and if you go to your pharmacy, making sure that when you do pick up your medication, you're not running too many errands, and you can go home and put your medications in the fridge. As well, if you get mail order to your house, making sure that your medication doesn't sit too long in your driveway, making sure that you can put it in your fridge whenever you can. We also talk about following up with your provider. Some patients, depending how well controlled their diabetes is, you can be following up with your provider from 3 to 6 months. And just an important point to take in case you miss your dose, just making sure that you pay very close attention to when you're supposed to be taking your medication. GLP-1s, some are dosed where you can inject every day, and some you can actually only inject once a week. So just making sure that you're being very careful if you're supposed to inject every day or once a week. If you do miss a dose and you inject every day, if you remember within 12 hours, you can take your dose. But if it's been more than 12 hours until your next dose, you can just wait till the next dose. And then if you inject once a week and it's been 3 or more days from the last time you remembered, then you can wait till your next dose as well. So just making sure, as we mentioned, just that if you do have any questions, you can always reach out to the pharmacy here as well. And you can reach out to your pharmacy if you go to any CVS or Walgreens or Matthews in town, that you are reaching out and having any questions you have answered.
I have one question for you now.
Yes.
Can people take GLP-1s as singular therapy for diabetes?
So for GLP-1s, also just segueing into that, we did talk a lot about insulin, but GLP-1s are specifically used in type 2 diabetes. We went through those medications in our last slide, but just clarifying that. And GLP-1s are used as an adjunct, as we spoke about our live last time. Most people start with metformin, and then GLP-1s can be used as an adjunct to make sure and help your diabetes be well controlled.
Thank you. And I see we have a little bit of time left. You can always send in questions after the fact to us. These are recorded and they're available through a couple different methods. I think they're on YouTube, and they're also on the website, the Rural Health website, I believe, at Ellenville Hospital Rural Health website. The question that I would ask, I'm going to put each of my students on spot just a little bit, and all of you have been here 2 weeks now anyway, and sometimes more. And today's Victoria's last day too, so you did well, and good luck in your future endeavors.
Thank you.
Hopefully we may see you back for API, if you so choose. We'd welcome you back, but it's obviously your choice. The question that I would ask each student is, what has been the highlight of your experience during your time here at Ellenville Hospital? So let's start with Victoria, because it's your last day.
No pressure. I've been here for 3 weeks, and it's been a great experience. Everybody that works here is really friendly, really knowledgeable. I think my favorite part of my experience here is just seeing how everybody works together. I love that the pharmacist has conversations with the nurses and doctors and the patients every single day, and that's just been really great. My highlight has been being part of this team.
Great, thank you. Darshal?
For me, it has been 2 weeks at Ellenville Regional Hospital, and it has been a really great pleasure working at this site. For me, I'm basically from city in Brooklyn, and for me it was really a good experience since I need to acclimate myself with the countryside. And then at the hospital, I was given an opportunity by Dr. Stearns to get around with the doctors and nurses and talk to patients, inpatient, and it was more patient focused, and it was more helping me towards how the patient care process has been taken care at Ellenville Regional Hospital. And Mike itself is a passionate, determined, and very friendly pharmacist to work with, and I would love if I can come over here for my AP rotation. Thank you.
Thank you, Darshal. You're welcome. Natalie? Natalie and I have known each other for a while.
Yes, this is not my first rotation with him. I actually did New Visions in high school, so I think we're at number 3 now. Because I was here last May as well, so magic number 3. But I would say my highlight for, honestly, I think all 3 rotations has been more of the intercollaborative environment. We touched upon that on our last Facebook Live. But just seeing how all the moving pieces come together and how it's important that we all work together to make sure the patient also has, you know, a better experience and has better outcomes. So I would say just seeing how, you know, it's not where pharmacy is in the basement and no one can come speak to the pharmacist and see if they have questions. Or so I think I would say the intercollaborative nature between seeing the pharmacy and nursing, not even just nursing the doctors, but PT and OT as well. So just seeing how we can all come together to better our patients and they can have better experiences as well.
Thank you, Natalie. I think that I've been here for a few years. I actually was in the CEO's office a little bit earlier today and introduced myself to the new administrative assistant. And Steve, the CEO, said, well, you've been here for a long time, right? About 25 years or so. And I said, yeah, I'm as old as one of the walls here. You know, so I've been around. I've seen a lot of change here. And I've been in pharmacy for over 40 years. And it still is exciting to me, and it's still fun to me to come to work. And I think that we're on the forefront of a lot of things that happen in medicine and in community health here in the Ellenville, Worcester area. So it's still exciting for me, and I love teaching. I love having students, and I look forward to having more. I think we're probably the smallest teaching hospital that I know of anyway, and it's not just pharmacy students, but we teach students from all professions and all modalities. So it's an exciting place to be, and having the students keeps us older folk up to date more, I think, and it's very helpful to have. And you know, things that I take for granted and you know, are part of my knowledge base. Every once in a while, a question will pop up that I have to think back through. Well, why do I have that thought? And so it's very exciting to have students, and certainly very excited to be able to do this Facebook Live every other week. So we should probably be back in about 2 weeks. Our 2 students to my right, your left, will probably will be gone at that point. So Natalie will be the last student standing for this year. I have no more students scheduled until February of next year, but maybe shortly after that we'll hopefully see you guys back if you're wanting to come back here. So thank you for the opportunity to Rural Health. We always give a shout out to Rural Health, because without Rural Health we wouldn't be sitting here doing this, and our community gets better with all of our efforts. And certainly, you know, the hospital's not a don't be afraid of coming to the hospital during this COVID crisis. The hospital is open. We will treat and we will help everybody that comes to see us. We have some wonderful programs. We were just talking about the pharmacy program that occurred yesterday, and when I first heard about pharmacy, I said, well, nobody told me about this. I'm a pharmacist there. And then I had to look at the spelling, and it was F-A-R-M-A-C-Y, and it's about giving fresh vegetables and milk and eggs and whatever's available locally to people that want it, really. And I think the lines of cars, I think it's like every other week on a Thursday. So give a call to the Ellenville Regional Hospital Rural Health Program, and inquire about the pharmacy, FARMACY, or call the hospital regular number 647-6400 229 for the pharmacy PHARMACY for medication questions. So I just want to thank Rural Health for this opportunity to sit here and do this live Facebook. Thank you.